When you need medical care, do you actually know how to get it? We offer coverage that gives you excellent care. We'll help you choose a plan and show you how it works. Our plans provide access to a network of doctors, specialists, hospitals, clinics, and more. They pay for a portion of the cost when you receive care, including prescriptions. Some services, like preventive care, are completely paid for by insurance. Other services are covered most of the way. You'll just pay a portion of the costs. The cost to you is limited if you stay in-network. Plus, the total amount you'll have to spend on medical costs within a year is limited. PPO plans feature an annual deductible and give you the flexibility to see the provider you want. When you need care, you'll pay for services until you reach the deductible amount. Then, the plan will share costs with you at these rates, depending on the care you receive and where you receive it. If you stay in-network and use community facilities, the costs will be shared. In-network, you won't need to pay above the annual out-of-pocket maximum. If you want, you can visit providers outside the plan network, although you will pay a bigger share of the cost. With HMO plans, you'll have to stay in-network for care, except for emergencies. When you go in for a service, your share of the cost will be a fixed copay, depending on the type of care you need, and there's no deductible. Keep in mind, through this plan, you must choose a primary care physician who will coordinate your care, and you'll need to get all of your non-emergency care through the Sante Community Physicians HMO network. Your medical benefits also come with prescription coverage and a network of pharmacies. You'll automatically receive prescription benefit coverage no matter which medical plan you choose. How much of the cost of medication you share with the plan differs based on which tier it belongs to. As you can see, Tier 1, or generic medications, will always be the most cost-effective option, and the mail order program can give you significant savings on any maintenance medications you may have. We've reviewed how you and your plan share costs, but there are also the upfront costs, or the premiums, which are taken out of your paychecks bi-weekly in regular, fixed amounts to help pay for your plan. You can cover yourself or members of your family, and your premium costs will vary based on your coverage level. You can use your plan design to your advantage. The first step is understanding your plan, but there are some simple things you can do to save. Take preventive care. You can use it for routine checkups and vaccines to prevent and catch issues ahead of time. Since there's no out-of-pocket cost, it's a waste not to use it. Try to use providers in the network. They are pre-screened and will offer the best rates. Be smart about your situation too. Going to the wrong provider or facility could leave you with a higher bill. Ask for generic or lower-cost medications instead of paying more for brand names. Tax-advantaged accounts such as the healthcare and dependent care flexible spending accounts are available to help you pay for out-of-pocket expenses such as deductibles, copays, coinsurance, prescriptions, dental, vision, and child care expenses. And use the mail-order prescription program if it makes sense for you. If your plan comes with a special tax-advantaged account, such as your healthcare and dependent care flexible spending account, budget your expenses and use it to help with your medical costs, especially when you need to meet a deductible. Anytime you need or want to speak to a doctor, call Teladoc from anywhere, home, work, or on the road, and let the doctor come to you. Teladoc doctors diagnose non-emergency medical problems, recommend treatment, and can even call in a prescription to your pharmacy of choice when necessary. For helpful resources, please visit the forum and click on the Community Benefits link, or simply call your HR Service Center.